An informative program on women's health. My name is Patty Kadoran, and I'm a proud member of the Board of Directors of the Milwaukee Urban League. I'm also passionate about empowering women and eliminating disparities, especially in the field of healthcare. During these challenging times, it is even more important to have the very best information to ensure that we, as women, can manage our own and our family's healthcare. So let's get started. I'm honored to introduce at this time the moderator of today's event, Dr. Eve M. Hall, President and CEO of the Milwaukee Urban League.
Good morning and welcome again to our community roundtable. Thank you again, Patty, for serving on our board and also for sponsoring our community roundtable. I think all of you know the purpose of the roundtable is to inform, it is to educate, it is to engage on critical issues. And I am super excited today because I know these women personally, and I know the commitment, the passion, the tireless efforts that they put into this community. And so it is just a treat to have them on board with us today. As many of us know, women of color increasingly face disparities in access to quality health and experience poorer health outcomes. They disproportionately suffer high rates of death during childbirth and are at increased risk of dying from stroke, heart attack, and complications from obesity, diabetes, and hypertension. I'm pleased to welcome our four panelists, as I mentioned earlier, to discuss how women can improve their own wellness and how we can address the social determinants that influence the health outcomes, especially for women of color. For instance, we know, according to the recent UW-Milwaukee State of Black Milwaukee report released in July, that in Milwaukee, Black infant mortality rates, teen pregnancy rates, and low birth babies rank among the worst for Black communities in the nation's 50 largest metro areas. So that relates to female health issues right here in our city. So let me introduce quickly who's on the panel. First of all, we have Gina Green-Harris, who is the award-winning director of the University of Wisconsin School of Medicine and Public Health Center for Community Engagement and Health Partnerships. If you would raise your hand or wave at everyone, Gina. All right. And I'm pleased to announce that she just entered the PhD program at UW-Madison. So she just announced that to me today. So I am ecstatic for her and know that that is truly going to make a difference. I mean, she's already bright, intelligent, and does so much, but just we know going to that level opens even more doors and opportunities for her to share all that she knows. Next, we have Jasmine Johnson. She is the Diversity Programs Director at North America for the Manpower Group. And most importantly, especially for today's conversation, she is chair of the American Heart Association's 2021 Go Red for Women campaign. Jasmine, if you could wave. Thank you. And then we have Mirta Sosa Pacheco. I'm learning her today. She is the program manager for the All of Us Initiative research program at the University of Wisconsin School of Medicine and Public Health Centers for Community Engagement and Health Partnerships in Milwaukee. So good to meet you today. Thank you for waving. All right. And last but not least, Vivianelle King. She is currently the Communications Advisor for the University of Wisconsin Center for Community Engagement and Health Partnerships. And we all know her well because she has had an extensive and award-winning career in television, public relations, and community relations. And most importantly for this discussion today, she recently launched her new book, When the Words Suddenly Stopped, Finding My Voice Again After a Massive Stroke. And I think all of us who personally knew Vivian, we were there with her. So it is an honor and a blessing to have her with us today. And she waved, and we thank you. All right. So without further ado, let's get moving on our questions, ladies. And I just want to remind the audience who's here, please submit any questions through our chat box because later on we will engage in conversation with our panelists. So, beginning with our first question, and this is directed to you, Ms. Gina Green-Harris. The Black infant death rate is 3 times worse than the rate for white infants and getting worse. What are the major factors contributing to this crisis? And what needs to change in order to reserve the mortality rate for African American infants?
So good morning, everyone, and thank you so much for that question. Before I answer, I just want to thank you, Dr. Hall, for this wonderful opportunity to serve on this great panel of great women. I am honored to sit among such great intelligence and just wisdom and knowledge, and so it is indeed an honor for me to be here. And the question you raise is an excellent question, and one to start off with. Quite frankly, you know, we look at Wisconsin, as you talk about infant mortality rates, not only do we have poor rates as a country, but Wisconsin in itself, and not just in Milwaukee, but the southeastern corridor of the state, and even in Dane County, has some of the worst statistics for birth outcomes in the country. And this is compared to some of our southern states, right, where we know poor health outcomes and social determinants of health are impacting their health statuses. So your question is really a good one. And what is it that is happening? And quite frankly, interestingly enough, we talk about the social determinants of health. We talk about wealth. We talk about social economic status. We talk about housing. All of those factors drive birth outcomes, right? We know that chronic stress is a driver, but when you think about how does chronic stress impact us, where does it come from? It comes from systems. It comes from systemic oppression. It comes from our systems that have been in place for several years that have denied us healthcare or inadequate healthcare, right? All of that lends itself to birth outcome. And then we also know for sure, as we think about Black women in this country having been marginalized since well over the 400 years of slavery, that residual is continuing to impact us as a people, and as birth outcomes are relative. And so complications due to pregnancy are at higher rates of Black folks, and Black women in particular. Again, getting access to appropriate care, making sure that African American women have adequate housing. We live in some of the worst housing conditions in the state. One thing I want to point out about Wisconsin that is very unique in comparison to some of our other Midwestern partners is that when you think about, if we were to look at the state of Wisconsin, the demographics show so much certain that Black folks live in literally one section or corridor of the state, primarily when you look at it, right? So the southeastern corridor is Black folk. And when you put people in, that's really segregation, right? And then it goes to the point of hyper-segregation, because when we think about this, when you have a section into one part of a state, then you're talking about where are those services, right? How are those services distributed across that area of the state? So for instance, give you a really great example. If we live in southeastern Wisconsin and the best healthcare is in central Wisconsin, what does that do to our population if that's where the majority of Black folks live? So that's an example, right? And I'll bring it even closer. You mentioned Milwaukee. When we think about geographic locations in Milwaukee, we know we're hyper-segregated, right? So the reality of that says that if I live on the north side of Milwaukee and there's no adequate health care on that side of the city, what happens to me if I'm a pregnant woman? How do I access good health care? And then how does that health care that I access that may not be adequate to serve some of my conditions of pregnancy, what does that do to me in the long run? So let me bring it home with some real concrete kinds of things. What is impacting Black women birth outcomes? Quite frankly, what's impacting our outcomes, we know, is one, systemic racism. Systemic racism by meaning, where are we living? How is our housing in relation to other folks? What's the lead situation in our communities, right? What is the impact of us having to live in communities where we don't have grocery stores, where there's food deserts, or now food insecurities as we call it, right? When we're thinking about employment, who's working where, and what kind of employment do I have? If I'm pregnant and I'm having complications with my pregnancy, but I can't get off work because I don't have paid sick time, how does that impact my pregnancy? How is it that when we're talking about unconscious bias from a provider perspective, a care perspective, if I'm telling my provider that I'm having significant pain, if I'm noticing complications in my pregnancy, but I'm not being heard by my provider, that contributes to my birth outcome or to poor birth outcomes. We do know one of the biggest drivers of infant mortality is premature birth. And Black women, again, 3 times more likely to have a premature birth outcome, simply because of healthcare and access to care, and how we know we are having higher risk in terms of just the employment situations. So those are a few things, and I'm trying to get all this into 1 or 2 sentences, but I think what I want you to get is the big picture, that systemic racism, when you account for all of this, it goes back to it. And I'll give you one nugget of information about how is that true. Oftentimes we talk about infant mortality in terms of poor Black women. But when you take into account that Black women with a college education have poorer birth outcomes than white women who have a high school education, that says something about systemic racism. It says something about access to care. It says something about access to just a better, more productive way of life. It talks about stress matters, right? We look at high levels of stress in Black women. Being Black can be stressful. We talk about policing versus security police, right? Policing in our community. What does that do to our stress level? And then there's some genetic pieces that also impact us, because if you're constantly under stress, it does impact you genetically, and that too contributes to birth outcome. So I'll stop there, but it certainly is clear that in this country, if we're going to talk about how do we address the birth outcome numbers and the poor birth outcomes, we're going to have to talk about the social constructs of racism, and we're going to have to talk about how do we redefine social justice in this country around reproductive justice as well.
So, I'm one of those who feverishly takes notes, on what is occurring. You've said a lot, Gina. I mean, what you left me with, though, was the social constructs, the redefining social justice, and I think the infant mortality justice issues. And then the other piece about even the equity, or what is happening in comparison to even women who've graduated from college compared to other women, if we're going Black, white women, those women who graduated from high school having better outcomes. And then all the factors that you listed around systemic racism in terms of lead, the housing, access to care, the food deserts and insecurities. So you've mentioned a lot, and the stress. I think just the general stress that women carry naturally, and then compiled with what's going on in our communities, in our country, and how that impacts our family. So thank you for really setting up the landscape of what we're dealing with right now. Okay, so that now takes me to Jasmine Johnson. As the chair, Jasmine, of the American Heart Association's 2021 Go Red campaign, what should women know about the risk factors of a heart attack? And what lifestyle changes can women make to improve their heart health? Jasmine?
Yes, well, good afternoon, Dr. Hall, and good afternoon to the amazing women that I have the pleasure and distinct honor to be alongside today. I'm tremendously humbled for the opportunity to be here with you all today. Thank you again so much for the invitation. And so as I am currently being tasked to lead and share the 2021 Go Red for Women campaign here, it's important to note, which to me is still so much work to do, but because they are highlighting that I am the first woman of color to ever lead a local campaign statewide for the American Heart Association of Wisconsin, to me, when I said yes to this 3 years ago, when I was still working in healthcare and it all made sense, but now finding ourselves in the midst of a triple pandemic, as a woman of faith, I don't believe in coincidence. And so for such a time as this, he laid out, and the ask was made over 3 years ago for me to step up and step in and lean in to this moment of time for women to go red, and specifically women of color. And so one of the things that I have set as a goal outside of the, dollar amount that I am tasked with our executive leadership team to raise is to also ensure that the executive leadership team for Go Red for Women of the American Heart Association of Wisconsin is reflective of the women of the community. What I mean by that is over the last 3 years that I've been a part of the ELT for Go Red, it was just myself and one other woman of color that was on the ELT. So in addition to, strategizing of how to achieve that goal that is set between now and May of next year, it has also been important to me to ensure that I am serving alongside women of color through this aspect as well. I thoroughly enjoyed the town hall last week that you all led, and with the release of the new report. And to be honest, Dr. Hall, because you've known me for quite some time, I'm typically nauseated as that younger next gen professional I'm like, why do we have to keep studying the studies? Let's get to work and find solutions. But the two things that stood out to me last week was that a person of color in the city of Milwaukee with a 6-figure income is farther away than a white person making only $10,000 due to the hypersegregation, due to all the social determinants of health that Gina mentioned, as well as being Black in Milwaukee today is equivalent to being in Birmingham in the 60s. And so for me, when I look at heart health, and being in an opportunity to lead the efforts of the Go Red campaign to make it more of a movement versus the one day, the first Friday in February, encouraging everyone to wear red for an awareness perspective. When we look at 1 in 4 women dying of heart disease, and for African-American women, the risk of heart disease is especially great. So when I look at that statistic about 1 in 4 women overall, and I look at the beautiful collateral that was designed to promote today's event, I'm a visual learner and I'm a visual individual. So when I look at that statistic and I look at, the panelists for today, that is, even more heart-wrenching of how heart disease is more prevalent among Black women than white women. And as some of the risk factors that increase the risk of developing it includes high blood pressure, overweight, obesity, and diabetes. So we talk about the social determinants of health and how all those things are interrelated. Cardiovascular disease kills nearly 50,000 African-American women annually. And of African-American women ages 20 and older, 49% have heart disease, yet only 1 in 5 African-American women believe that she is personally at risk. And so for me, when I look at, women and the risk factors for a heart attack, or even, the walking miracle that we see in Miss Vivian, I look at how stress kills. So Gina, thank you so much for laying the stage for me and talking about all those things that are interconnected. And so for me, when I'm looking at those risk factors and, genetically, I have been fighting through family history, high cholesterol, leading into my 30s. My grandmother passed at 55 years old this summer before my senior year of high school from a cardiovascular heart related event through her additional risk factors of obesity and high blood pressure and being borderline diabetic. So when I look at stress kills, all those things that even a working professional, educated, college educated woman, and even a woman of color that is facing through this triple pandemic of being in a global health pandemic, underlying the economic catastrophe that's currently going on, as well as the continuation of the social injustice. So I like to, give a visual. So for example, for me, having to toggle in between conference calls while my 13-year-old African-American male son was in between his remote learning for school. He came to me and I tried my hardest to not allow him to see the video of Mr. George Floyd because I felt it was completely unnecessary for him to experience that trauma. But he was able to find the video and found it. And he came to me in between his virtual classes and myself in between conference calls and said, I just watched the video and I know you've already seen it. How do I navigate a world where my skin is the weapon? How can they always seem to find a way to de-escalate the situation with other people who are armed and have just murdered people, but not with people who look like me? And I had 10 minutes to regather myself from finding answers to the questions that he was asking me that I really didn't have and trying to process myself before I had to put back on that face and log into my next meeting. In a corporate environment where I struggle to find another person that looks like me to interact with on a consistent basis. After fielding calls for 8 weeks straight every single day with a positive diagnosis of someone in my extended family, and ultimately resulted in over a dozen of deaths that I've personally known and have been robbed from the opportunity of saying goodbye. All of those things, all of those stressors, combined to all of the other additional things that Gina already talked about, contribute to that. So when I look at the question that is posed of the risk factors of a heart attack and what lifestyle changes can women make to improve their heart health, with the majority of women being the head of household, being the earners of income, and when you look at the stressors of housing, transportation, and even for those that have the privilege, like myself, to walk in my corporate job, but dealing with the constant questions of being expected to be the Black experience for every single one of my colleagues, it's all of those stressors that I have to find myself and force myself to take those moments and make those moments to breathe, to sometimes just count to 10 and regroup in order to still stay focused and ensure my productivity is still beyond excellent in order to continue to provide and take care of my family. So while we find ourselves navigating a triple pandemic, I must emphasize to women and women of color that self-care is more imperative today than ever before. And so whatever that one thing is for you every single day, for me, it is finding the 15 minutes, like locking myself in the bathroom and, listening to a few of my favorite tunes, or finding a podcast that I have been trying to get to. I've committed to finding one thing to do for me every single day in order to regroup, to rebalance, and, even finding that time for a 10-minute meditation of mindfulness to recenter. So my one thing for women and those men that are on the phone that have been touched by a woman in their life, because one cannot argue with the data. And when you look at the data of the dire statistics around heart disease, and specifically those patients and populations of color that have been tremendously and disproportionately impacted and continue to be, is finding and forcing that self-care in order to, the breathing is tied to regulating high blood pressure, looking at, healthy ways to create boundaries. And that's the last thing that I will leave you with as well, is in addition to self-care, I've had to reset and create boundaries even within my work schedule. Finding back-to-back calls from 8 to 6 o'clock is really not sustainable. And you're toggling between, do I hydrate? But if I hydrate, I don't have any breaks to even go to the bathroom. And eating lunch after 4 o'clock, 4 out of the 5 days a week is not good. So proactively even blocking out, 15, 20 minutes of time to be able to figure out lunch in the middle of the workday is, again, something that I found helpful. So those are the last two things that I would leave individuals to consider in order to change their lifestyles is regaining control of your day-to-day activities, boundaries, and committing every day to self-care. Thank you so much, Dr. Hall, for the opportunity to share.
Oh, thank you. Thank you, Jasmine Johnson. I want to thank in addressing women's health alone, just as part of your own mission. What you brought up today, several things. One, I'm sure all of us were moved by the question that your son asked you, because we are all trying to reconcile with our youth on what's occurring today and why it's occurring and how we need to address it. And that is an additional stress, especially for mothers of color. I mean, that is the reality. So that stress alone is something that, we're all dealing with, either directly if there are sons, our nephews, whoever is connected to us, husbands, etc. I think the other piece, thank you for your commitment around diversity with your leadership team that's raising the money and that's raising the awareness, and that you want to go even beyond the campaign in terms of diverse conversations about the inequities again and the impact of women of color. And then just your focus around how we must take some time each day, which I know for all of us on this call is challenging, because we're always used to being the nurturers for everyone else, and being able to take that time for us is huge. So, again, thank you for that contribution, and even mentioning, which moved me as well, from our town hall about the comparison of where we are as a city to Birmingham. That's a huge thing for us to continue to think about in addressing our concerns. So thank you, ma'am. We'll be coming back again. So moving on, Merita, who I've gotten to know today and just so excited you're on the call. You are involved in the groundbreaking medical research program called All of Us. Tell us more about what the program aims to achieve for women's health, and why women of color in particular should be involved. Merita?
Thank you, Dr. Hall. It was really, really good to meet you virtually today. And also, Jasmine, really good to meet you. I am grateful and blessed that I work directly with Gina and Vivian. So I'm very happy to be on the webinar today. I'll sort of answer the question in two parts. First, I will review sort of what the All of Us program is and what the goal of it is, and then cover why it's important for Black women and communities of color, women to participate in the study. All of Us is a national study that was launched in 2015. Part of an initiative that was launched in 2015 by President Barack Obama called the Precision Medicine Initiative. So the Precision Medicine Initiative is a federal effort that is launched out of the NIH, that is the National Institute of Health. The National Institutes of Health, they are part of the US Department of Health and Human Services. They are the biggest funder of health research in the country, and I think actually the world. They are the biggest funder of health research. So for example, when you think about cancer research and vaccine research for COVID right now, COVID treatment, all kinds of health research, heart disease, all of that comes out of the institutes that are at the NIH. So the Precision Medicine Initiative is an initiative that is trying to, with research, technology, and policies, trying to work together so that patients and researchers and providers, healthcare in the future in the United States can develop sort of individualized care. And that's important because, disease treatment and prevention right now sort of takes an one-size-fits-all approach. And we know that because of lifestyle, socioeconomics, environment, and biology, that we all are different, and so that it doesn't really make sense that our healthcare is one size fits all. It makes more sense that we can have best care, more possible based on us uniquely. So, what kind of questions can the program answer. So the study in itself is trying to get 1 million people across the country to join and to give their health, to share health information on themselves. So you would join, you would, and I will explain more because it's very, it's a lot. The endeavor is very lofty. They are asking people to share their electronic health records. Because right now, as you know, if you go to Freighter, let's say for your heart health, and then you go to St. Mary's for your gynecology, those are two separate providers and information and sort of records that are kept separately, but maybe your reproductive health is tied definitely to your heart health because we are one body. So they want to look at electronic health records. They want to look at surveys that people answer themselves that gives information to them. And they also are collecting biospecimens. So they're taking physical measurements of people, and they're also taking blood or saliva samples. And this is for genetic and for biological research. And, you know, maybe different questions. People are like, well, why do they need all that information? Well, you know, how can we prevent chronic pain that affects, you know, 100 million people across the United States each year? Why do some people, you know, react differently to pain medications in a way that isn't addictive as compared to other persons who are more prone to addiction to a pain medication? Or, you know, diabetes, like, are there better treatments for diabetes than the current pill that we have right now, right? Metformin. 10% of Americans have diabetes. We know that communities of color have higher rates of diabetes. So how can we make better treatments for that? Dementia and Alzheimer's. We also know that African Americans and Latinx groups, they have higher rates of Alzheimer's. You know, let's research that. You know, is there a treatment? Is there a cure for it? And especially cancer cures, you know, there's a lot of trial and error that happens with chemotherapy, you know, now. In Milwaukee, the Center for Community Engagement and Health Partnerships, we have our community advisory board, and one of our chairs is Dr. Alonzo Walker, who is a retired surgical oncologist from Freighter, and he specialized in breast cancer. And so he was very adamant in sort of sharing how with breast cancer and all cancer specifically now, doctors are trying to move away from just sort of being like, let's try this medicine, or let's try, you know, after your surgery, if this level of chemo works and this medication works, and instead trying to actually genetically test people and see how individually someone could have a unique care plan for their cancer that will help them more than, you know, the trial and error or something that is very painful to go through. So the program itself, you know, again, is trying to understand the whole person. And as Gina and Jasmine have mentioned already, these are a lot of factors. So environmentally, you know, chemical exposures, air pollution, water quality, zip code, what kind of work do you do? So occupational, social, like education levels, stress, literacy, health literacy, financial means, all of these things affect your health. Biologically, clinically, the program is also looking at, you know, all the different levels of the building blocks that make us up biologically. So they're looking at genomics, right? DNA. Gina mentioned how stress is something that can be passed. Stress is something that can affect your body genetically. This is an emerging research that's called epigenetics. And so, you know, it kind of looks at how your genes, like your mother's genes while they are pregnant, and maybe even your grandmother's genes, how do these affect the markers of how you will most likely maybe show up with or handle obesity or heart disease or diabetes, apart from all the social things. So it's not just social, it's also biological. And so the research is trying to look at that as well. So a couple of reasons why it's a little different and why it's important is that research has historically only been done, it has only historically sort of invited the white male population to be a part of clinical trials, to be a part of, you know, different treatments and all that. And that's two ways. Number one, because they have, you know, that's just the representation that they've been invited to be a part of. And number two, because this population is sort of already sort of set to trust the health research more to begin with. We know that communities of color, let's just for Black Americans, for example, you know, people know about Tuskegee and what happened with that horrible syphilis study. Right now, you know, the Immigrations and Customs enforcement, they are forcibly sterilizing immigrant women in detention. And so all of these things, historically and presently, that cause communities of color to like not trust the federal government for very obvious reasons. The program is understanding and owning that research has not been inclusive in the past, that it has been abusive in the past, and they want communities of color to, they want to be transparent and invite this time fully openly, fully respectfully, trying to be ethical about the research, and so that we are represented for new treatments this time around. And the last thing that I'll finish on is that I wanted to respond to something that Jasmine mentioned about how she was sitting down and looking at this study, and how you're talking about studies, and you're like, I'm just over, like, we know what the studies say, we know, you know, over and over again, it's obvious that socioeconomic, that all of these factors affect our health. And so we know that policy is something that needs to be worked on now, right? Policy for housing, for education, for access and health, you know, health insurance, everything. But, you know, the research is still very important biologically. For example, when you think about generationally, how long is it going to take us for these policies to manifest in a way that affect us? You know, right now we know environmentally, we're going to hope, right, that environmentally it will, you know, get better. But in the meantime, a lot of people have cancer, and children have rare forms of cancer. And, you know, if we can find ways that do the research to make these treatments better, I think that's really important for our communities to be a part of. So thank you.
Thank you, Merita. Oh my goodness, you are involved in just really some life-changing research and being part of that initiative where you're trying to reach 1 million on a national basis. You know, what really stuck out to me is when you speak about the trust levels with communities of color. What has occurred in the past, as you said, the Tuskegee Institute, and then what is happening with immigration. I've been reading that about the sterilization of women. And so we are really at crossroads at a time of trying to transcend the trust issues and get to where you're talking about, and trusting that really this time around, as we identify these million individuals, that it will really help to turn around the impact and the treatment. I think the other piece is just the mere fact of inviting us to be a part of it, because as you said, treatments have been designed for others, but not always been designed for people of color. And so oftentimes we don't react the same way in terms of the treatments that are given to us. So your work on this initiative, both locally, statewide, and nationally, is so critical. So we're glad that you're at the table, and just thank you for sharing all of that information. All right, Mirta. So next we will go to Vivian King, who is going to begin, you know, her presentation actually with a video. And so just so you know, the question that she will be asked is, in your book, Vivian, when the world suddenly stopped, you've written very powerfully about the stroke you suffered from having taken birth control pills. So what do you want women to know about the risk factors, especially associated with stroke? So with that, let's begin the video.
I literally had to find my voice again.
A health scare can strike out of nowhere when you least expect it. Would you be prepared? Do you have someone close to you who can help? How would you survive? When the words suddenly stopped details the journey of former television broadcast journalist Vivian King, who, with virtually no warning signs, unexpectedly suffered a stroke that robbed her of her voice. From a grim diagnosis, she battled through neurological intensive care and hours of therapy to a point where even her doctors were calling her a miracle. King admits the medical care she received was unparalleled, but she believes her secret weapons were her faith, family, and friends, converging to lead her from trauma to triumph. If you've ever had a health emergency impact your life or the lives of a family member or friend, this book is for you. It shares how, through her ordeal, Vivian learned the importance of what she now calls the 3 Ps. Having a posse to assist and advocate for you in the healthcare system, showing persistence with pushing toward healing, and prayer, how your prayers and those of others can change everything. This book also reveals how a common pill can cause chaos in a woman's life. Keep the chaos from your life. Start assembling your posse today.
You can never really know when the words will suddenly stop.
So, Dr. Hall, thank you so much for the question and for this opportunity. And I too was thrilled to be asked to be on this panel because all of you are my friends, and I think all of you are brilliant. And so I'm glad to be amongst you. I don't know if I'm all of that, but I'm glad to be around you. Maybe some of that will rub off. But you saw my trailer, and it really just capsulizes what my book is about. And it is, you know, all of a sudden I suffered a seizure at the Girl Scouts breakfast, was rushed to Aurora Sinai, was there for about an hour, then rushed to St. Luke's, and I was in neurological ICU for 10 days and in the hospital for a total of 32 days. And on discharge day is when I really learned what caused my stroke. Birth control pills over the age of 40. So I did not have the risk factors that are all on all of the major lists that people, that healthcare institutions list. And so birth control pills over the age of 40. When I tell people, as you know, when I first suffered and when I told people the cause, half of the women said, oh yes, I knew that. Some said my doctor took me off birth control pills in my mid-30s. And when they asked why, the doctor told them, because you're too young to have a stroke. Well, my doctor didn't tell me that. And so half the other women, when I tell them what caused my stroke, they look at me like deer in headlights. And they said, what? I'm still on birth control pills. And so my main reason for writing this book is to start this dialogue. Research has been talked about, and I know when I first started working for the Center for Community Engagement and Health Partnerships, we had Dr. Jonathan Jackson come in and speak, and I was telling him about my book, and he said, yes, that's a gap in research because they have not researched how birth control pills even impact African American women. And so we need more research around that. And so that's why I really wanted to write this book, to really start that dialogue. But along the way, I learned some powerful things. And so that's where these 3 Ps come in contact and come into fruition. Because I'm a single woman living here in Milwaukee. I'm originally from St. Louis, so I don't have biological family members here. And I live by myself. And so I rely on my faith. And so I woke up that morning, it was October 25th, 2013, and I thought to myself, it's a Friday morning. I really don't feel like going to this Girl Scouts breakfast. But my friend Sadna had invited me weeks before then. And at this time, I was the vice president of community relations at Aurora, and I would fill tables as well. And so I would hate when people canceled at the last minute. So I didn't want to be that girl, that woman, right? And so I said, no, I cannot disappoint Sadna. And thank God I did and thought of that, you know, whatever was in me. I think it was the Holy Spirit basically saying, you need to get your butt up. So I get up, I get dressed, I walk out of the house, you know, without makeup on, which is not unusual because sometimes, yes, I may do it on the way to work, not while I'm driving, but at stoplights. And I know some of you on here maybe have done that. And if you don't finish at stoplights, then you finish at your destination. Well, I arrived at my destination, and that I did not think about that at all. So that tells me that something was going on at that time. But I was still functioning because I got out of the car, went into the hotel, started to go into the ballroom. People were talking to me. I remember talking to them and saying hello. I get to my table. They asked me, are you okay? And I said, yes, not realizing anything was wrong with me. And they said, maybe you need to eat something. I took one bite of sausage, and that's the last thing I clearly remember for 10 days. So in that, you know, Milwaukee, I live in River West, and I was headed downtown. So in that 10 minutes, because I felt fine, there was nothing, I did not feel there was anything wrong with me when I left the house. So in that 10 minutes, something started to happen, because as soon as I arrived at the Girl Scouts breakfast, I collapsed within 5 minutes of arriving. So if I had collapsed, if I had not gotten up to go to this breakfast, I would have collapsed in my house. It was a Friday. My friends and colleagues know that I like to travel. They probably would not even have thought about where I was until I didn't show up to work on that Monday. So my posse and my faith and my friends converged to lead me from trauma to triumph. And the other reason that I wrote that book was to share with people, you need to have a circle around you that knows about what's going on, that checks on you. So right now I have a good friend. We check with each other at 8 o'clock in the morning and 8 o'clock in the evening. You okay? How you doing? You know, it's a simple text. Sometimes we talk, but just to make sure that we're still among the living. And the other thing I wanted to do was give other stroke victims hope. There is a light at the end of the tunnel. And if you are persistent with what your doctors and therapists tell you, and you are determined, then you can get through this and get to the end of this tunnel, this tunnel as well. And there's hope for all of us. And so I'm just, you know, it'll be 7 years this October 25th. And I call that, so I'll be 7 years old, because that was my new birth, if you will. And so I just feel like God gave me the gift of communication, and I wanted to write this book. And this is really my testimony, so that other people can maybe glean something from my experience. Thank you.
Thank you, Vivian. That was so powerful. And just, you know, I just have to share, as a person who communicated with you during that time, I mean, bringing that meal right to your room, and just thinking about where you were at that point, and all of us just holding our breath that entire time you were in the hospital, and praying, because it was like our Vivian, this energetic and lively, being in a totally different place at that time. So, you know, forgive me for those, you know, who may have a different spiritual belief, but this was God in your life. And this was God saying, I have greater work for you to do, to now impact people and women in a different way, and using the gifts that you have to really help all of us, you know, who that could easily happen to. And so I just thank you for hearing God in completing your book, in following this journey, persevering. Those times were not easy. And also just that reminder of how important friends are, our sister friends are, beyond family, because sometimes we're not surrounded by immediate family. So, but that's where that community love and care comes in, which I think is so cultural anyway. When you spoke about just the gap in terms of research for women over 40 with, birth control pills, and us really not having that kind of information, or once again, even if you're under 40, what does that mean for Black women in terms of the impact? I think that connects back to what Mirta is talking about in terms of how important this initiative is to really bring people of color into the fold on treatment practices and what needs to happen for us that may be different for other people. So, again, just thank you for sharing. Happy 7 years, happy birthday for 7 years in this new birth. So with that, what I'd like to do in closing out before we engage our attendees is from each of you. And I think each of you in some respect has shared what we need to do. I know Jasmine has mentioned how we need to be taking that time. But if we can just get that word once again from each of you, and that includes you, Jasmine, as well, to just remind us as women, what is it that we need to do to make sure that we are self-caring? Share with us a couple of the practices that each of you uses to help maintain and just have self-care for yourself, that I know many that are on this call are trying to deal with in terms of diet, in terms of exercise, quiet time, whatever that is. So Mirta, I'm actually going to start with you this time, with you sharing, and then go to Gina, then Jasmine, and then Vivian. You each could take a moment to share, and then we'll open it up for questions. Mirta?
Thanks, Dr. Hall. I think, again, something that Jasmine said before that is just like mega, mega important to me is our boundaries, and especially boundaries that are between like work time and personal time. So I, for an example, definitely, after 4:35, I shut off all computers. I will not look at it unless I'm like super, super busy, but I just will not look at that email until the morning. And I think also in this time that we're working at home, those lines can get so blurred that it's just like, oh, well, I'm finding myself answering an email at 7 p.m. and I refuse to do that. And apart from that, definitely have taken some ownership of mental health. And just if you have the privilege and the possibility of speaking with a therapist, a counselor, a psychiatrist, I think that is something that would really help our communities moving forward, and just being able to share, because we are, everyone's under a lot of stress.
Thank you. Gina?
Yeah, thanks so much for having me again on this wonderful panel. And, I think it's a really interesting question to ask Black women, what do you do for self-care? Because we often don't know. I mean, we make stuff up on the go, quite frankly, because we fly planes in the air and while we're building it, though, right? And so asking me that is like, really, what do I do? But I just want to really, some things that I've been practicing is, one, I think it's really important for me to always know my purpose. Why am I doing what I'm doing? Because sometimes we get busy work, right? We get so caught up in the midst of being busy, and we have no real reason to know why we're busy. What is this I'm busy stuff, right? And if we get caught in that tango, then we allow people to actually dictate what we're doing, and we then lose the capacity to actually rest. the capacity to take a break, to step back, because we're so caught up in being busy that we don't even realize that that busyness is really not part of is not our lane and is not our work. And so I think that's important for me. And then also to do that reflection. And then I think being my authentic self and self-care is important for me to be Gina, no matter what audience I'm in front of. Because if I'm not, that affects my mental capacity, and that stresses me more. So most of us on this call are used to being in audiences that don't look like us, right? So we're always on. We're constantly always trying to make sure that we're saying the right thing, we're sitting the right way, we're looking the right way. And particularly now, with us always being on video, what does my facial expression say as compared to what my mind is thinking? Am I all right? Do I need to shut that camera off? Well, sometimes shut the camera off, because you gotta, you will implode if you do not actually, exhale. And so I think that's really an important part of, and show up to be true to who you are. That takes a lot of weight off your shoulders, because I can tell you, I'm Gina no matter where I am. And that is something that people have to either accept or respect. It's one of the two. But the bottom line is that it helps me mentally know that I don't have to show up as somebody else. That is powerful for me. And then when I think about this whole notion of stepping away from my circumstances, yeah, that's an intentional move. It's like Mirtha say, well, I don't shut my computer off at 5:30, most of you know. But I do have to check in with my circle of friends who say, how are you taking care of yourself? What are you doing? I got a really, really good friend there's two really good people who call me on a regular basis and say, have you taken care of yourself today? I'm concerned about you. I notice you're doing X, Y, and Z. What are you doing? And that forces me to stop and think and to really say, I can't be everything to everyone. And I think that's a critical piece we have to take away. And I'll shoot this last thing out. In this current, we keep talking about these pandemics and that we're in, and the circumstances and this whole new notion of what's happening. And so unfortunately, we can't cut that off from us, right? I can't stop being Black. Not that I would want to, but I can't. And so the reality is, how do I then acknowledge that being Black to the world may be a sin or a crisis or a problem, but to me it's a blessing, because that's how God made me. And I have to really formulate that in my mind, so that as I'm expressing myself, or that as I'm living all of the things that we see on the news, I still got to find some good energy around that to say, what are the positives that can actually come out of this situation? And then the question is, what's my role, and how do I make sure I'm doing that in a way that's healthy to everyone, but mostly healthy to me? Because the other thing I will leave you with is, and this is, if you don't hear anything else I say today, and I know that a couple people on this phone, and all of you all who know me, because I know all of you on this phone, I have learned over the last 4 weeks the infamous 2-letter word, no. And it's okay to say no. It's okay to say, I cannot do that this time. I've got to take care of me, because we are in such a state that we're constantly on. And shut those televisions off for a little bit and just get some me time, get some God time. We are talking about our faith. Spend some time alone with yourself and with your faith and with your God, because that will help you as well. So I'll stop and I'll end with that. And I want to just say thank you so much again for having me today.
Wow. So, Dr. Hall, I'm supposed to go after the one and only Ms. Gina Green Harris. So
You can do it. You can do it. You can do it.
Okay. First and foremost, Mirtha had mentioned, I just wanted to clarify quickly about the importance of research. And so when I was talking about, the continuation of studies, it was not by far mentioned, because coming from a 20+ year career in healthcare, upon the 13th career before choosing to come back to Milwaukee with the world's largest biopharma research company who helped launch all of us. For me, it's more about driving those solution oriented. So not focusing on what those dire statistics continuously are without couching it with a solution, in which all of the work that you are all doing at all of us is so important, because it is exhausting to be consistently reminded of being the first in all of the worst, and you have to navigate all of those things and those tangible examples that I gave when I was sharing, you know, with my son, and then having to like wipe his tears, wipe mine, and then get it together for that video, Gina, which I had to be on camera for that one. I didn't have the option of being off camera. But it is traumatizing. And then you get to that same job on that same meeting and you pay less money because of the pay inequity. So when you're looking at those self-care moments and being able to really own it, but not dwell in it. And when you talked about busyness, Gina, and living a life on purpose, to me, that is so important. And at that last tea, Dr. Hall, that you were referring to back in March, I talked about how busyness is an addiction. And for me, that was my way of self-medicating to not deal with the trauma of being the only consistently in corporate spaces, or abruptly becoming an only parent to a Black male child due to the trauma of your marriage being forced to end because your husband is trying to kill you. So I didn't have a choice in that moment, but for me to dwell and cope would just keep going and not wanting to face and deal with me and running from that. So I opted in the busyness to not, face and deal with, the trauma of having to say I am a survivor of being in a domestically abusive relationship. I had to accept the fact and deal with the trauma of admitting that what I thought was my plan and moving with intention, all of those things were shattered. And so for me, because having COVID forced you, Gina, to like take those quiet moments with God and oneself, because, it's in those moments, I was scared of what was on the other side, right? Like, let me just keep going. Let me just keep moving, because I was fearful of once I opened up that box and had to deal, I didn't know what was on the other side. So for me, it's moving with the intention of, what one is purposely created to do and be. And the greatest thing that you can give to yourself is time, because that's the only thing you can't get back. So being able to create those moments for yourself, and whether when we're traveling, Vivian, because I know how much you love and I love to travel, we're always reminded of putting your mask on first, because we are no good to anyone else. And so that is a constant reminder to myself. And that's why through this self-care, for me, is forcing myself to find, even if it's just 10 minutes, because I am worth that. My sanity is worth that. Not being subject to a life event and being no good and not around for my son is worth that. And not fulfilling the mission that I'm created, that he's given me to do and be, is not worth that. So for me, it's forcing yourself to craft out even 10 to 15 minutes just for yourself, whether it's waking up early in the morning in that quiet time, or before you're settling yourself in the evening. So that would be my one thing to add on to all of the things that was already said, was gift yourself the thing that you can't get back, which is time.
And why do I have to go last after all of that? But anyway, everything that was said is just so valuable. And I guess one thing that I learned and recognized when I was going through my ordeal is that I am not in control, and God is. And so a lot of people are going through a lot of different things during this pandemic. I think my experience going through my stroke made me realize that I cannot sweat the small stuff, because 99.9% of everything that we do and think about and give energy to is small. And so we don't need to worry about that. The only thing that we can control is our reaction and how we respond. And so I want to respond in a positive way. I don't want people to say I contributed negatively to a situation. And so I need to get myself together. And so one thing that I try to do, now granted, I used to work on television. I love television. I'm a TV girl, right? Growing up on all the TV shows, and then doing the news. I do not watch the news as often as people would think. And I get my news, in the morning. Occasionally, I may watch in the evening, but that is occasionally. But I need to make sure that I don't have the negative things that sometimes come from the news, especially hearing it over and over and over, and having worked in the news and having transitioned from when we just used to have nightly news at 5 and 6 o'clock to 24-hour news. You can get bombarded, and then add on that social media, and you need to set some barriers, and you need to make sure that you are not caught up in all of those things that can cause stress. So in the morning, I make sure that, the instinct is to pick up the phone and see what's going on. And sometimes I'm guilty of that. And then I say, Vivian, you have not talked to God yet. You sit down, and I have to then make sure that I start off the way I want to and the way that I need to. And so that I can ask, what is my purpose for the day? What do I need to get done? And strengthen me where I am weak, and boast and let there be less of me and more of you in everything that I do, so that I can maintain my core. And I try to be non-judgmental. Because you can look at people, you don't know why somebody didn't speak to you. They could be thinking about, anything. And we get all, she didn't speak to me. He didn't speak to me. She looked dead at me. Sometimes if you're thinking about something, you're not focused on what's in front of you. And so just to be non-judgmental, because, in the spiritual realm, we ask God for forgiveness, and he wants us to forgive other people as well. And that's the only way that we can really get to some change and some healing. And so, I would say, have that little talk with your creator, and make sure that you are kind to people and non-judgmental, because we all deserve forgiveness.
Wow, thank you, ladies. I was, again, I write my copious notes trying to pull from all of you. So what I heard was turn it off. We have to know when to turn it off. And, as we're all working remotely, this has been a blessing and a curse, but it really does demand self-discipline. It's okay to say no. And we're all so about yes, but being able to say no. The busyness disease, I thought, was excellent, because we all tend to be so busy, but what does that really mean? And oftentimes it's what are we trying to avoid? I think the COVID piece is really interesting, because I will tell you all, even from a personal place, when COVID hit and we were at home, it hit me one day that if COVID had not occurred, and I thought about my own schedule, I said, Eve, I don't think you were going to make it. And it just came across my spirit. And I got more rest. And, we don't know, as bad as this is, that COVID could have been a savior for so many of us, because it forced us to shut down, to come close to who we were, and to also realize who's in our life and what really is most important. And now that we're kind of beginning to get into that new phase again of somewhat recovery per se, but we're not recovered, we really have to almost make ourselves go back to when we were forced in COVID to have that time. So, then that's just what came across me as I was listening to each one of you say something. Don't sweat the small stuff. That is huge. We can so easily get caught up in things. I think Vivian's book is something we all need to get. Many of you have probably read it. I have not. I've got to get that copy. I guess I just talked to Vivian so I can get that inspiration personally, but being able to read that. And I just want to share another book with all of you. In addition to what Vivian is reading with her personal stories, I'm actually going through a book called The 40-Day Soul Fast, S-O-U-L, by Cindy Trim. And I see people shaking their heads, so they may know about that book, but for some of you that may not, it is definitely a book that takes you on a spiritual journey, and really forces you, if you're disciplined, and I've been really working through that, to really take a look at different aspects of ourselves and really look at what everyone has mentioned around purpose and being true to ourselves. And I think each of you somehow hit that piece on being very clear about what we were designed to do and be, and to stay true to that. So those are some of what I've gained. We really don't have any questions, and what I believe is that there was so much information, ladies, that you gave, that you just empowered everyone. And I'm sure all of those people that were on the line, from just the, 33 comments that have been shared, I will tell you right now, those comments have been about how you have empowered, how you have reminded those that are on about self-care, but are also a reminder of what we have to do in terms of the doing. I think Jasmine brought that up. We are all always overwhelmed with statistics over and over and over and over again. But this is a time to be solution oriented and to do. And so I just thank you for what each of you does every day, and for your persistence, your commitment, the power, the influence that you have in helping to make a difference in this community and to anyone's life that you touch across this country and across this world, because each of you is on purpose right now. You are doing what God has designed you to do. So continue to stay in your purpose. And thank you for blessing the Milwaukee Urban League in being a part of today's community roundtable that is so important. You know, women are the center. Women are the nurturers. When it comes back down to it, it is about women. And so we really have to take that very seriously and take care of ourselves, because we all need each other. So with that, I want to say again, Gina Green Harris, Jasmine Johnson, Nerta Sosa Pacheco, and Vivianelle King, we thank you, we love you, we honor you for who you are, and as they say, in whose you are. And everyone, look for our next community roundtable, which will occur on Wednesday, October 28th. You can always go to our website, www.tmul.org, which will always keep you updated on all of what we are doing as an organization. Ladies out there and men, be well. I will challenge you to do something special for yourself. In fact, Jasmine already sent me a note saying, and what are you going to do for yourself today? So I have to make sure that I do that, Ms. Jasmine. Thank you for checking. And so now I'm going to say to all of us here, let's do something special for ourselves today and think about how we can do that each and every day. Everyone be blessed, have a great day, and thank you again for today's panel.